Well, thank you for your time. Um, I
Anytime.
guess, yeah, I guess I'll start by introducing myself. So, I'm Nish. I'm a rising junior in North Carolina. I'm just making this short documentary about drug addiction to raise awareness about the early signs of addiction and how to eventually get help if it gets to a stage too far. Yeah,
Nice.
yeah.
So, is this like a school project or is this something that you do on your own? This is a really cool thing that you're
Uh,
doing.
yeah. So I thought I'd do something different with my summer. So I came up with a small project. So yeah,
That's
yeah.
really cool.
Thank you.
Are you wanting to do like film in the future or
Uh, no, I like photography and stuff, but I would want to do biomed or something in biology for sure. Yeah, yeah,
who knows where life will take you, you
yeah.
know?
I know. Yeah. Just to get like a little background, what do you do specifically as a doctor?
So, my name is Dr. Gerdie Jean-Smith, and I'm a board certified family physician and geriatrician. And so, I'm both a hospitalist, meaning that when you go to the hospital, I'm the doctor that takes care of you when you stay the
Mhm.
night in the hospital. And then I also have my own outpatient practice with my sister, Dr. Samantha. So, um, either after the hospital and you recover, you come to the clinic, or, when you
Mhm.
just go and see your family doctor, to get a
Yeah.
checkup and get your vaccinations. I'm that doctor who does that as well.
Is how often do you encounter drug addiction in the hospital, like or in the clinic, right? Yeah.
So, it actually depends on where I'm working.
Hmm.
So, when I'm in a major metropolitan city, I'm going to see drug addiction every
Yeah.
day. But if you're in the small town that I am in, so I'm originally from Port Charlotte, Florida. So it's a place where people go to retire. Drug addiction looks a little bit different because they're mostly addicted to drugs that are prescribed by doctors. But in major metropolitan areas, like where I got trained in Louisville, Kentucky, they are going to be addicted to street drugs like crack, cocaine, heroin, which is totally different, but both of them are addiction.
Hmm.
So it's hard to say how often I see it. So if I'm in the hospital at night, I'll probably see it every night where we have somebody who is either, we call it acutely intoxicated, where they just got a high and they're maybe caught by the police doing something they
Yeah.
shouldn't because they don't have their right mind, or they're withdrawing, or they have a complication of their addiction, whether that's infection or a heart attack or whatever it could be. So I'll see at least one every night in a major metropolitan area. And then in my small town, in my office, I have patients who are on these prescriptions that are prescribed by doctors, and we're trying to talk about how to find alternatives to get off of their pain medications and medications for anxiety, which their body is essentially addicted to,
Yeah.
but they may not see it that way.
Yeah. Makes sense. That makes I sense. Guess it yeah, it depends where you live and where you work. Yeah. So
Yeah.
what would you say are like the basic starting causes of addiction?
Okay,
Is
so a
that?
tough and loaded question. So
Hmm.
what are the causes? There are so many. Um, it's not necessarily the causes, but things that put you more at risk to being addicted and that kind of goes into your next question too. So genetic, like you ask, is it
Yeah.
genetic? So if you have a family history of addiction, so a father, a mother who is fighting with addiction, you're more likely to also fight from addiction as well. Another major risk factor. So some doctors say there's over like 72 risk factors
Oh.
on what can make someone addicted to, drugs and
Hmm.
medications. So I'm just going to do like the top one. So family history or genetic predisposition. So if you grew up in a household where addiction was prominent and prevalent, then you're going to be anywhere from 20% to 80% more likely to have
Oh,
an addiction. And it depends on the drug as well.
mm,
And also, if you hang out with the wrong friends, so your friends is going to be one of the next risk factors for addiction. So if you hang out with the wrong crowd, it's really
yeah,
true, you can end up doing drugs. So that's a major one. And if you already are addicted to other substances, so it might start off as something really, really simple, like caffeine. You're addicted
mm,
to coffee, you are more likely to develop a second addiction.
oh,
So if you're addicted to smoking or tobacco, you're more likely to get addicted to something else. So it could be something really, really mild. So those will end up being like the biggest risk
mm.
factors for getting addicted to drugs.
Do you
Mhm.
say like your environment, like people and places around you? Do you think and like maybe stress, work-life balance?
Oh, yes,
Yeah.
I did not even get into that. So, other causes is stress and mental disorders. So, if you're struggling with other mental conditions, that usually goes hand in hand with addiction. So, depression, anxiety, schizophrenia, bipolar disorder, all of those things, oh, ADHD, all of those
Mm,
things can be risk factors for dealing with addiction. And then your environment. That's why if you have a parent or family member who's struggling with addiction, that's your environment that you're in, and that can also increase your risk for addiction. So those are some of the things that you want
yeah,
to watch out for. And that's
yeah,
why they say don't hang around with the wrong crowd because your
mhm,
environment can really do it. And there are some areas in America. So like I was saying, if you're in a major metropolitan area, you may be exposed to drugs more frequently, or if this the area that's where drugs are prevalent,
yeah,
then you might be more at risk. So, some areas you can see them just on the street blatantly. And then that's going to make you more at risk for drug
yeah,
addiction. Yeah.
yeah. That makes sense. So what are the early signs, like in the like really starting phase? Like,
So signs is just even trying it once. So basically what determines if you're going to get addicted is how it works in your brain. So addiction is related to dopamine, which is what we call neurotransmitters or hormones in the brain, however you want to describe it, but dopamine is one of those. And when you experience something that your body likes, your brain releases dopamine and it says, I like more of this. And it could be something simple like you just tasted the best chocolate or ice cream. Your brain's going to release dopamine and you're like, I love this. I want to try eating this again. Or like you just got an A plus on your exam and you're really proud of yourself and it makes you happy. So your brain releases dopamine. So what some drugs do, well, what most drugs do is when you take that drug, it releases that dopamine really quickly and really fast, and it produces this tremendous high where you're like, I absolutely love this. And so then it trains your brain to say, I want more of this.
mhm,
So um, this is the part of your brain, the mesolimbic system, that is for reward. And that's where addiction comes from. So when your body says, I love this, that's like a reward for your body and it makes you want to do it again. And so when that's used in a good way, it says, I want to eat chocolate again, or I had a really fun experience at school. I want to hang out with my good friends again. That's a good use of the reward system of your brain. But when you take it with drugs and then you get this massive release of dopamine and it stays in your system longer because it makes it so that the nerves in your brain, um, doesn't pick it up as easily. And so it stays there longer, and you're like, I really want to keep doing this. And so that's how addiction uses the good part of your brain, the reward system,
mhm.
and it turns it into a bad reward in the
Yeah,
sense that you don't want to be rewarded to keep doing drugs,
mm,
but that's kind of what it's training the brain to do. So it will physically change the structure of your neurons in your brain.
Oh, really?
And yeah, and so that's why doing drugs, especially at an
Oh,
early age, can permanently change the way that your brain works. And so once you have done that drug, you're more likely to be addicted because you got this really big sensation that was enjoyable and pleasure and reward. And so your body may want to do it again. So that's the early sign is
yeah,
once you do it,
yeah,
you're
yeah.
definitely going to be at risk for it again.
Mm,
Um, and then so then you have a whole slew of things of like, is it starting to affect your school? That can be a sign that you're addicted because now this substance is interfering with things that are important. So in your case, in youth, it'd be school. For adults,
mm,
it's work. Is it affecting your relationship with your friends and family? Are you willing to steal to get more of it? Because a lot of times it's a really expensive habit.
mhm,
So sometimes you'll find that they will steal and betray and to do whatever they can to get their hands on it. Another early sign of addiction is that you try to stop, you want to stop, but you can't stop.
yeah. So
So
I heard you said like your nerves or neurons, you said that
yeah,
they don't pick it up um as much as they used to. So does that mean that you would need more of the drug to satisfy the same
eventually,
like yeah.
yes. Eventually. So there's two phases of addiction. You have first when you first have it, and so you're gonna get that release of dopamine really quickly, really fast, and that's that initial high. Okay. But then as you keep doing it, your brain is not going to release dopamine as fast and not going to pick it up as fast. So you're going to do more and more to get that same release of dopamine and that same pleasure and
Yeah.
reward. So, and then the neurons start getting damaged, so they're not going to work as good. So you're going to need more of the drug to produce the same result.
Mm,
So, neuron is the cells that make up your nerves. So that's why I say nerves, but neuron is the
hmm.
smaller part of that cell.
Yeah.
So, multiple neurons make your full nerve.
Hmm. Yeah.
So, those are the parts in your brain that it's going to release those dopamines, which are called neurotransmitters. You have different neurotransmitters, epinephrine, dopamine. Um, I'm sorry, like,
Yeah.
all those
Yeah.
norepinephrine. Yes, you're taking me way back to med school. Yeah. So, yes, you're going to definitely need
Yeah.
more of that drug, and that is going to make you at risk for overdose
Yeah.
when your body gets too much, and
Yeah.
that's why you can
Makes sense.
accidentally die. Yeah.
Oh, do you think they like there be different signs in like would you say like there would be different signs in youth than adults?
I don't think it would be different because it's still the same, like it's going to start affecting your relationships. It's going to affect your schoolwork. The only difference is your relationships might be different. So
Mhm.
for you, the sign might be it might start affecting your relationship with your parents, or your friends. Whereas as an adult, maybe it will start affecting your relationship with your girlfriend or your husband versus,
Yeah.
so it's still very similar, but it just might be in a different way
Yeah.
because you may not have a job that you have to pay your bills with. So, people who are addicted are going to struggle with going to work and they might lose their job. And so that they they can't pay their bills, and that might result in homelessness.
Mm.
So, a lot of homelessness is linked to mental disorders and addictions. So it might be a little bit different for a kid because they're not having the same responsibilities, but ultimately it can lead to a similar result. You may get kicked out of school. You may get
Yeah.
kicked out of your house.
Hmm.
And because
Yeah.
you've stolen and betrayed and all of those different things. And I think there's a lot of factors that go into addiction and some of the signs, but I think at the end of the day, they're all very similar in that it's very detrimental in either way.
Yeah.
And I don't know that if I said another thing that might be a risk factor is sexual abuse.
Mm.
Tends to be a risk factor for addiction and drugs. So those are things that youths are probably going to be experiencing, and that affects them all the way to adulthood.
Mhm.
So, when I've dealt with patients who have addictions, a lot of times it stems from childhood things that happened to them as a child. And that precipitated depression, anxiety,
Yeah.
and they try to self-treat with different types of um, drugs
Yeah.
to
Yeah.
get over that. So it's addiction is so complex, and it doesn't matter what race you are, what nationality you are, how old you are, how much money you have. Everybody is at risk for addiction. So that's why they say there's over 72 risk factors because almost everybody can be at risk for it.
Yeah.
And it's a really hard and tough situation, especially if they've been through something that um, is traumatic, whether it's emotional abuse, sexual abuse, physical abuse, all of those things will be risk factors for developing addiction.
Yeah. Yeah. That makes sense. How can one get help, or how can one get help? What are some like resources?
So the first step is being honest with yourself and recognizing that you might have an addiction, because if you don't recognize it, you won't know that you need to reach out for help. And I think one thing I can say as a parent, my daughter's 3 years old, so not even close to thinking about that. Always being vigilant as a parent to look for signs in your child that they might be addicted to different substances. Like I said, looking for the things like, having trouble with school, having trouble with friends, being more isolated and withdrawn, all those things, like looking for changes in your child. And so that way you can start to be more attentive and listen closely. So I think one of the best ways that if you want help is go to someone you trust, and adult, not another teenager your age, because that may not be the best resource. Because it's not about keeping the secret, and you're not helping your friends when you do. So if someone does go to you and then they're your age group, then I think it's so important that you tell them that, hey, this is something that we need to tell an adult about, and you encourage them to tell an adult. So, going to an adult, someone you trust, like your parents, and asking for help. And then parents need to be helping in a non-judgmental way.
Mm.
So not making your child feel like it was such a bad idea to tell them. And so listening attentively. And another place that you can go is to your teachers in school, because sometimes they have the right resources to guide you in the right place. And then the third place would be your doctor. So next time you have an appointment, you can always ask your parents to step out of the room and talk to your doctor, and your doctor can definitely guide you to the best resources to get help. And there are, different phone numbers and helplines that you can
Yeah.
call. Because again, addiction is closely linked to depression and anxiety. So a lot of times those are the things that needs to be treated in order to get through addiction. So I would say like those are the best resources is an adult you trust, your teachers, your doctor, different helplines, and last, the thing that my patients do is they go to the emergency room. Sometimes a friend calls the ambulance for you, and
Yeah.
that's another resource. Yeah.
Mm. So just like find a close circle of people that like you can tell, like a trusted group of people.
Yes, exactly.
Yeah. But do you think the government or like society in general could do anything more to help
I
addicts?
think it all starts with doctors. I do feel like I didn't even approach the subject of, like I said, the addiction from prescription
Yeah.
medications. Getting them off the streets in the first place is something that we as doctors, the government, everybody can do better. And I think providing more support to people with addiction, because we almost make it seem like people with addictions are a problem versus providing a solution. Because like I said, addiction is stemmed from all of these other risk factors, whether it was mental conditions or abuse or, families with it. So if we don't address the root cause of the addiction, then we're not helping anybody. So just telling people to stop is not going to
Yeah.
work. And so I do feel like we could do better as a society to not be judgmental towards people suffering from addiction and not ostracizing them and making it seem like, what's wrong with you? Like, why did you even do it in the first place? Like, very judgmental is, I think, some of the biggest issues. So we as a society can provide more support and understanding and more education because sometimes it's curiosity as to why um, people resort to drugs and addiction, especially starting earlier, the wrong group of friends,
Mhm.
or like I said, getting them out of that environment that um, hurt them. So I would say that we could definitely do more as a society. Doctors can do better with prescribing so that these
Mhm.
are not on the streets and we're not using them as a solution. Um, and then making sure that we get down to the root cause of why they started doing the alcohol, the drugs in the first place. And
Yeah.
so we as a society can do that. And I think, in my opinion, I never really understood why people just go to jail for drugs. I
Mm.
feel like, if anything, we should give them more support rather than thinking that by putting them in jail for doing drugs, that's going to
Yeah.
solve the problem
Yeah.
because they just do drugs in jail. So, you know, it doesn't really help anything at the end of the day. So
Yeah.
I feel like we need to find a much better way to handle drug charges. And
Yeah.
instead of going after the little guys, going after the people who's like making the drugs, because we know that there's a hierarchy of drug of how it gets on the streets. And yeah.
Overall, what's like one piece of advice that you could give to uh us, the young adults, teenagers about addiction?
I would say never start. I
Yeah.
know that's like easier said than done, but like I said, once you experience that sensation, your brain can start getting conditioned to want that experience again. So, the best advice is to never start, but I think it also starts with your environment. So, I guess before that piece of advice is to really watch who your friends are. I think that's probably one of the things that would probably be the most important piece of advice because you may have never even thought of it until you were at a party or you were with your friends and you were offered it. And so, of course, that's when curiosity kind of comes in and you're like,
Yeah.
huh, I wonder what that would be like. So I think there's a lot of truth to, bad association spoils useful habits, like one bad apple
Yeah.
spoils the whole fruit. Like every
Yeah.
saying in the world, like would apply to youth and staying away from drugs is like literally staying away from the wrong crowd. And if they think it's cool, that's not the people you need to be around.
So surround yourself with good people. Yeah.
Yes.
Yeah.
And if it's in your home because your parents are doing it, I know that's going to be a lot harder, but finding a way to escape that type of environment, whether it's, through after school activities, sports, those are things that have saved many people from addiction
Yeah.
because they were able to leave that bad environment and go into a more constructive environment. So your friends and leaving that
Yeah.
bad environment is going to be the best thing to do to prevent addiction.
Yeah. Yeah. That makes sense. That's all I have for now. Yeah. So I think we're good. Yeah.
All right, let me know if you have any more questions. And I'm really proud of you for doing this. And this is how you stay away from drugs, right? You stay busy doing other things. So you said you're in North Carolina. Is that a big
Yeah.
problem over there?
In schools, yes. So, especially in high schools, there's in the bathrooms you see people drinking, smoking, vaping, and then like there's weed trades going on, and yeah. And then I saw drug addiction, and I was like, yeah, it's a big problem. So,
Yeah. So
yeah,
those people are definitely going to be at risk for doing drugs in the future because once you do one substance, it's very soon that a second one is going to follow.
yeah,
Hmm.
makes yeah.
All right,
All right,
Nish. If you need anything, you have my cell phone number and
mhm.
email. I'll be happy to answer
All right.
any questions. Okay.
Thank you,
All righty.
thank
Bye-bye.
you. Have a good night.
You too. Bye.